Pitch is presented by Knowledge Success and supported by USAID.
This is The Pitch, a continental competition looking for the next knowledge management innovation in family planning and reproductive health. From over 80 applications from around the world, 5 were chosen as semi-finalists from Africa. With just 5 minutes to deliver their pitches, they will be under great pressure to convince our judges to fund their innovations. A total of 2 winners will be selected as our KM Champion Innovators. Determining who will win an award of up to $50,000 US, let's meet our 6 expert judges. Rodeo Diallo is Interim Deputy Director, Optimize Family Planning Interventions, the Bill and Melinda Gates Foundation. Dr. Joanne Peter is a Director of Social Innovation at Johnson & Johnson. Mkwinda Budahasana is a full professor of the Department of Biostatistics and Population, Faculty of Public Health, Universitas Indonesia. Clyde Mutunga is a Senior Technical Advisor, Population, Environment, and Development at USAID. Dr. Tara Sullivan is the Project Director of Knowledge Success at the Johns Hopkins Center for Communication Programs. Anthony Daly is the Deputy Director of Family Health at the Bill and Melinda Gates Foundation. The stakes are high. Who has what it takes to be one of the next KM Champion Innovators? Hello, I'm your host, Lisa Mwaikambo from Knowledge Success. Before we meet our semifinalists, let's hear from the judges about what made them excited about this competition.
Innovation is always refreshing in our field. I feel excited, open, intrigued, and curious to learn from around the globe.
I'm really looking forward to hearing some of the innovative solutions out there and hearing what that means for sustainability, what that means for knowledge capture and sharing all over the world in order to really strengthen FPRH policy and programming.
Thank you, judges. Now, let's get started with our first semifinalist.
Mesdames et messieurs les membres du jury, bonjour. Je m'appelle Fatou Diop et je représente l'Alliance nationale des jeunes pour la santé de la reproduction et la planification familiale. Le défi que nous souhaitons adresser est le manque d'informations sur les pratiques à haut impact en PFSR en Afrique de l'Ouest francophone. Partout dans le monde et principalement dans la zone du partenariat de Ouagadougou, plusieurs interventions ont été menées durant cette dernière décennie par différents acteurs. Ces interventions ont permis à ces pays d'arriver à des résultats remarquables en ce qui concerne le bien-être des femmes et des filles et plus particulièrement la planification familiale. Le Sénégal et le Burkina Faso émergent du lot à travers un certain nombre de pratiques à haut impact mises en œuvre et ayant permis d'importants progrès. Ces 2 pays ont presque doublé leur taux de prévalence contraceptive ces 10 dernières années, en passant de 18,2 à 32,5 pour le Burkina et de 14,4 à 27,7 pour le Sénégal. Aujourd'hui, leur type d'intervention mérite d'être documenté, partagé aux différents acteurs et intervenants afin qu'ils puissent s'en inspirer pour pouvoir l'adapter à leur contexte et contribuer à leur mise en échelle, afin d'accélérer les progrès vers les objectifs du PO de 2030, c'est-à-dire doubler le nombre d'utilisateurs de contraception moderne pour atteindre 13 millions. Notre solution va donc combler ce manque d'informations sur ces pratiques à haut impact. Elle va avoir 2 principaux axes. Le premier sera une synthèse de ces pratiques et innovations à haut impact au Sénégal et au Burkina par des points focaux qui seront capacités à la documentation des expériences. Le deuxième consistera en une dissémination de ces pratiques et innovations identifiées auprès des acteurs et des décideurs avec comme principale intervention l'amélioration du site web de l'UCPO qui est la principale plateforme de partage d'informations de PFSR pour les 9 pays membres du PO. Nos activités pour ce projet seront donc globalement le renforcement de capacité des organisations de la société civile, y compris les jeunes, sur les principes de base de la gestion de connaissances, des pratiques à haut impact, de l'étude de cas et de la recherche qualitative et quantitative. Ensuite, une cartographie des pratiques à haut impact au Sénégal et au Burkina durant cette dernière décennie. Ensuite, une étude approfondie de ces pratiques à haut impact avec une mise en exergue des meilleures pratiques et de leurs approches. une dissémination à travers du contenu web et des échanges virtuels. Ces activités se feront en même temps au Sénégal et au Burkina. Pour le Burkina, un point focal sera choisi et rejoindra l'équipe du projet dès le début. Il aura ainsi en charge la mise en œuvre du projet dans son pays en collaboration permanente avec l'équipe de projet au Sénégal. La dissémination se fera en étroite collaboration avec l'UCPO qui nous offre déjà une bonne plateforme d'échange et de partage regroupant des professionnels de la PFSR, des gouvernements, des jeunes des 9 pays du PO. Nous allons ainsi nous appuyer sur leur site web afin de publier ces pratiques à haut impact qui ont été étudiées et nous organiserons aussi des sessions de partage de ces pratiques à haut impact avec la communauté de PFSR des 9 pays du PO en nous appuyant bien sûr sur les chargés de liaison pays de l'UCPO ainsi que sur leurs points focaux dans les 9 pays membres avec qui nous avons déjà l'habitude de collaborer. Notre budget global pour ce projet est de 49 967 000 $, les 75% du budget étant destinés aux activités pratiques du projet, c'est-à-dire les réunions, les formations, les enquêtes de terrain et bien sûr les sessions de partage. Donc notre solution a beaucoup d'avantages. La première, c'est cette accessibilité qu'offre déjà, que va offrir cette plateforme, le site de l'UCPO, qui sera améliorée et mise à la disposition des acteurs, des décideurs et des partenaires pour un accès et une utilisation de ces pratiques à haut impact identifiées, mais également pour un partage continu d'informations sur leur utilisation et leur mise à l'échelle. Les partenaires tels que l'USAID, la Fondation Bill et Melinda Gates, etc., qui accompagnent déjà depuis toujours l'Afrique de l'Ouest, auront ainsi une meilleure visibilité des résultats de leur appui, mais aussi pourront mieux axer leurs interventions grâce à l'identification des pratiques porteuses et des leçons apprises. Une durabilité aussi qu'offre le site de l'UCPO qui existe déjà depuis près de 10 ans et qui regroupe 9 pays. Aussi, l'amélioration de capacité des OSC et des jeunes sur la méthodologie de l'étude de cas et l'importance de le joindre au rapport de fin de projet et programme pour documenter les pratiques développées dans leurs interventions et ainsi contribuer à l'amélioration continue des connaissances en PFSR. Ces jeunes membres pourront ainsi continuer bien après la fin du projet à alimenter et à utiliser le site de l'UCPO. Travailler avec les youth leads et les country liaisons et les points focaux ainsi que le think tank jeune nous permettra ainsi d'assurer la durabilité et la pérennité du projet. Les partenariats avec les bailleurs de fonds, les décideurs, les équipes de communication pour une meilleure diffusion des résultats de l'étude sur les pratiques à haut impact au niveau de leur plateforme web. Donc, chers membres du jury, ceci est la solution vraiment innovante et pérenne que nous avons à vous proposer. Nous permettre de la mettre en œuvre, c'est de faire confiance non seulement à une organisation de jeunes du Sénégal, qui est très engagée, mais aussi de permettre aux 9 pays membres du PO et bien au-delà de s'inspirer de ces pratiques à haut impact qui ont été développées au Sénégal et au Burkina pour atteindre leurs objectifs d'ici l'horizon 2030 et d'intégrer l'importance de documenter et de partager les meilleures pratiques en termes de pratiques à haut impact. Merci beaucoup.
Wow, what a presentation. Let's go to the Q&A.
Thank you for the pitch, Fatou. My question is, can you tell us about the existing usage of the OPCU website? Who is using it already? How can we be sure that the content on that website will be reaching a large audience?
Beaucoup, Joanne, pour la question. Donc, pour le site de l'UCPO, en ce moment, celui qui s'en occupe, c'est déjà Etrelabs qui s'en occupe. Et donc, nous, ce que nous voulons, c'est vraiment améliorer ce site web-là, notamment en intégrant des données qui vont être nouveaux parce que quand même les pratiques à haut impact dans ce site-là n'ont pas été réactualisées depuis 2018. Ça, c'est un fait. Et ensuite, dans leur cartographie des interventions, il y a beaucoup d'items qui manquent, comme par exemple, il y a beaucoup de programmes qui sont en train d'être mis en œuvre dans nos pays et qui n'y figurent pas pour l'instant. Donc, pour vraiment assurer qu'un public aussi étendu puisse bénéficier, puisse en tout cas utiliser ce site web-là, je pense que ça, il n'y aura pas vraiment de souci parce que ce site web-là, c'est vraiment le site de l'UCPO, de l'unité de coordination du partenariat de Ouagadougou. Et donc, nous savons que le partenariat de Ouagadougou regroupe 9 pays membres. Et ces 9 pays-là pourront assez aisément pouvoir utiliser ce site web-là lorsque les données seront mises à jour régulièrement et aussi lorsqu'il y aura de nouveaux pratiques à haut impact qui seront mis sur ce site-là. Merci beaucoup.
A big round of applause for our first semi-finalists. Do they have what it takes to win? Keep watching.
As a young advocate for sexual, reproductive, and health, I was so sure my stories won decision makers' hearts. As I've matured, I knew I needed to do more by using data and evidence, but every data-related meeting and capacity-building workshop I attended was always boring and overly complicated. In fact, I soon realized that I was not the only one. Even adults, including health program managers, service providers, and policymakers, can't make much sense of all the jargon. Hello, my name is Margaret Bolaji Adebola, and I am the founder of Stand With a Girl initiative in Nigeria, a youth-led organization dedicated to ensuring that every girl in Nigeria, no matter where she is born or found, is empowered to fulfill her full potential. We empower girls' voices to meaningfully participate in decision-making processes and programs affecting them. At the global, national, and subnational levels, efforts are progressively made to ensure that data gaps in ANJ-SR are closed, even though some progress have been made in the collection of ANJ-SR data. It's been slow and insufficient. However, what does exist in terms of relevant and disaggregated data at the national and subnational levels should not be overlooked and must be used to inform programming. A recent development in Nigeria has positioned the National Health Management Information System, NHMIS, to be able to generate adolescent responsive data from the routine health information process with age and sex disaggregation for the first time. While this is such a great news, this data need to be analyzed, interpreted, and presented in a simplified format to support decisions that will address low modern contraceptive prevalence rates among young people in Nigeria. What do we do then? Making near and real-time data simple for decision-making, tagged data for the simple, is the answer. We will liaise with the state adolescent desk officers in 5 selected states in Nigeria who have begun generating this adolescent responsive data to engage youth advocates between the ages of 18 and 35 to implement the NHMIS data in a simple, friendly, catchy, and responsive format. This 25 data advocates will be selected from the State Technical Working Group on Adolescent Health and Development based on their interest in adolescent and youth data, knowledge, experience, and understanding of ANJ-SR issues and creativity. This project will strengthen the capacity of those youth data advocates on data use for decision-making as they are mentored on how to interpret data and simplify it objectively, yet creatively. Their experiences as young people will support their creativity in ensuring that the data presented tells a compelling story about ANJ-SR issues. We are aware that some projects have supported state government to develop fact sheets and in some cases, infographics. However, this project will focus on catchy photos, doodle arts, storybooks, infographics with less numbers and words. These materials in indigenous languages will be used to engage state and local government policymakers, community gatekeepers, development partners, and donors. The outcomes of this engagement will be actionable plans to promote ANJ-SR outcomes. Here is what we stand to gain. As you may know, data, evidence, and innovations are critical for effective policy implementation, including addressing various barriers to ANJ-SR, strategic expansion of services to young people, and cultivating best practices in program design, implementation, evaluation, and learning. This project will support the effective implementation of Nigeria's new national adolescent health policy, especially at the subnational level. This would also support meaningful youth engagement participation in data for decision making. Ultimately, adolescents and youth will become key drivers for improved modern contraceptive rates among young people. A total cost of $49,947 is needed to implement this project, especially to fund capacity building of the 25 youth data advocates, local government monitoring and evaluation officers, adolescent desk officers on data-driven programming and data use for decision-making, data analysis, interpretation, and design workshop to develop storybooks, doodle acts, and infographics in the 5 selected states. SWAG initiative will leverage on our strong existing relationship with ANJ-SR partners in the selected states to ensure full implementation in 5 months.
Nice work. Hey, judges, do you have any questions for the semi-finalist?
Thanks. You talked about your plan for data being more accessible and simplified. Can you talk about the plan for how and who would use it, how it would be used? And then once the products are developed and used, then what's your plan for continued updating and production of simplified access for data that comes later after the project?
We are engaging 2 sets of audience. So one is the community level stakeholders, and that's the traditional leaders, the religious leaders, and then there are different platforms already, like the QIT, and the World Development Committees will look at, would make some decisions about young people's health, and in this case, adolescents' sexual and reproductive health. So we intend to engage them working on existing platforms and meetings that they already have. The other set of partners are the government, so at the local government level and at the state level. So already we have directors' meetings, and also importantly is the state technical working group on adolescent health and development. So this is a group that meets quarterly and discuss on issues that affect adolescent and youth. So we will be leveraging on this to do that.
That was an impressive pitch, but will it be enough to convince our judges? Stay tuned as we're joined by our next semi-finalist.
I am Dr. Olufadewa. I am the Executive Director of Slum and Rural Health Initiative based in Ibadan, Oyo State, Nigeria. Do you know that an average health professional spends about 30 hours a month looking for credible health information? This includes some of my colleagues who call to ask, Dr. Isaac, the woman with me has breast cancer. Can she take a hormonal contraceptive? Dr. Isaac, a 16-year-old teenager wants a long-acting reversible contraceptive. Should I give it to her? So I thought, what if we could have a platform that simplifies, summarizes, and shares the latest accurate information on family planning? I am Dr. Olufadewa. I have a master's in reproductive health and I am a solution provider. My team and I developed Reproductive Health Information for All, RIFA, that will usher in a world where fellow health professionals don't have to sort through an encyclopedia of health information or make panic phone calls before managing to get the latest reliable information on family planning. I am also the Executive Director of Slum and Rural Health Initiative, one of Africa's largest youth-led non-profit organizations that delivers health information and services to underserved communities in Africa. Our solution, Reproductive Health Information for All, RIFA, connects to this mission and advances our organization's purpose. We have a track record in getting the information that people need in a format that they can use. For example, we created and translated the Stop COVID-19 infographics into over 100 languages, arguably one of the world's most translated health information materials. Our innovation, RIFA, utilizes a hybrid model of lead serve or email group and a weekly reproductive health newsletter. The RIFA email group will be a moderated and interactive platform where health professionals from all over the world can share reliable reproductive health information, ask questions, and collaborate. The weekly reproductive health newsletter will share the latest family planning advocacy, policy, and research content to our global audience. RIFA will be coordinated by a technical working group of experts in reproductive health and trained volunteers to ensure the accuracy and simplicity of the content. Our innovation, to the best of our knowledge, will be the first of its kind globally to use this hybrid model to solve the challenge of information overload. RIFLE leverages successful model of health information for all and global health now, which have a broad focus on global health. It is worthy to note that Health Information for All, an email group only platform, already has over 20,000 members from 180 countries, and the Global Health Now, a newsletter only platform, is read by millions of people. RIFA members will be recruited from active email groups, family planning organizations, health professional membership databases, partnership with other reproductive health organizations, promotion on social media, and direct recruitment by volunteers. RIFA will leverage risk-proven strategies used by other successful platforms to increase its membership base. RIFA also leverages an efficient model that is sustainable and easy to manage. RIFA will propose partnerships and be open to collaborate with other reproductive health organizations and university programs that focus on reproductive health and population studies. Furthermore, our innovation can be integrated into existing work by being the choice platform for disseminating high-impact family planning campaigns, conferences, and opportunities. In addition, RIFA can be scaled to multiple languages for a wider coverage. RIFA uses a cost-effective model. We are requesting for $2,720 for this innovation. The majority of this funding will support internet stipends refund for the reproductive health experts, who are the technical working group members and volunteers who will develop the content, respond to questions, and nurture engagement with the RIFA membership. The budget also covers costs for the development of the RIFA website, which will host the archived e-newsletters, internet devices, and necessary software costs such as Zoom and Campaign Monitor to not only facilitate content development and dissemination, but also provide opportunities for live virtual engagement with the RIFA membership. Every week, RIFA will provide members with simplified content that feature priority family planning policies and programs. This will enable reproductive health organizations to design and adapt their local programs, encourage collaboration, and improve family planning practice at the community level. Furthermore, the platform will share brief summaries of high-impact studies to improve knowledge and facilitate adoption by members. If funded, RIFA is an innovation that is projected to reach 3,000 health professionals globally in 5 months and 30,000 in 5 years. In a world of too much information, too little time, and too many unanswered questions, RIFA is the solution. Fund and support RIFA as we create the world's largest reproductive health email group. Thank you for your time.
Wow, great job. And now let's see if our judges have some questions.
Thank you very much, Dr. Isaac. My question is just about the central piece of your proposal, which is the vast data and information that needs to be synthesized, ensured for accuracy. How could you speak a little bit about how you anticipate volunteers being able to really process all that information? And of course, as we know, in the age of fake news, how would that be ensured to make sure that the best and accurate information is delivered to the health professionals who need it? Thank you.
All right, so thank you very much for that question. And that's RIFA, Reproductive Health Information for All, to be able to carry out our duty, which is the central piece, like you rightly said, of providing and curating accurate information for people or health professionals that will be on our platform. We have a technical working group members, and the technical working group members will be experts in reproductive health and who have a good track record in doing this. We plan, and my team and I have developed a plan to use standard and recognized, reliable websites and also platforms. For instance, we have the reproductive health journals that are standard, and such as the BMC Reproductive Health, Journal of Family and Reproductive Health. We also have several other platforms like all the high impact practice from USAID, developed by USAID, and so many other platforms. So we are going to be leveraging on already recognized and professional platforms to curate our content. So we're not going to be going to several other platforms that are not yet recognized or that are not yet what we call accurate with their information. Then the technical working group will sort through that detail and be able to really answer the question and be able to ensure that the volunteers work with what the technical working group members who are experts and will be chosen from different reproductive health organizations, not just from Slum Health Initiative from around the world. Thank you.
This is very innovative indeed. My question has to do with sustainability. What is your plan to sustain this work? Do you have a pathway or plans just to sustain the work, because it seems to be responding to a need among the professionals? Thank you.
Yes, we do have a plan to sustain this platform. First is the fact that before the end of the 5 months program, we're going to be having a grants team who will be working on applying for other grants that can help in prolonging the initiative. Also, we have made a commitment by ourselves to run the program for nothing less than a year. With using the funding from the organization itself, from our various other funding, working with the team, and we also have what we call a funding plan, in sense of we look for a way to ensure that by collaborating with other platforms, such as other bigger platforms, we hope and then we believe that we'll be able to get enough sustainability for the platform. And looking at it, we also have a crowdfunding part to the funding, so where we can also crowdfund from people that really love the platform based on the impacts that we'll be able to generate in the long run. Thank you.
Great points in that pitch, but were our judges impressed? We'll find out soon. Let's see what our next semi-finalist has in store.
Greetings from the warm heart of Africa, Malawi. My name is Hester Mkwinda Nyasulu. I'm the Executive Director of White Ribbon Alliance for Safe Motherhood, Malawi. White Ribbon Alliance Malawi's vision is to see women and girls realize their rights to quality health and well-being. And we do this through activating people-led movements for reproductive, maternal, newborn, and child health. We bring together various partners, including civil society organizations, academia, private sector, and government entities, to work together in responding to the reproductive and maternal needs of women and girls. One of the challenges that Malawi is currently facing is the access to family planning data. This is despite Malawi having a robust database called the DHIS2, which captures information from all the public health facilities in Malawi. The reports on this platform are generated on a monthly basis, and this data can be very useful for decision-making among family planning stakeholders. However, in a simple survey where we asked participants at a recent Safe Motherhood Technical Working Group meeting about the use of family planning data, only 20% of the stakeholders have access to DHIS2. And most of those that have access admitted that they do not easily find family planning information. The reasons behind this are twofold. Number one is that one requires to be provided with a username and password in order to access DHIS2, and this does not come so easily with the bureaucracies in government. Secondly, the DHIS2 currently does not have a dashboard specifically for family planning information, and one has to check through the database to find the information that they're looking for, a process that is not so easy for many. This is an unacceptable situation. This means decisions are being made with limited reference to family planning data, and our women and girls are not being supported well enough because family planning stakeholders do not really understand their needs. In a quest to find a lasting solution to this challenge, we held a meeting with the Reproductive Health Directorate that is responsible for family planning issues, and the Directorate of Planning and Policy Development that manages the DHIS2. The two directorates are ready to act. We just need a push of financial resources to address this challenge. Several key activities need to be done. The first activity is to develop a dashboard for the family planning information. This activity will be led by the Reproductive Health Directorate in conjunction with the family planning partners in Malawi. Secondly, with the support of an IT consultant, we need to develop a dashboard on DHIS2 on family planning data and link the report to the Ministry of Health's website, specifically the Reproductive Health Directorate page. Once this is done, the Reproductive Health Directorate commits to sharing the link of the report or the dashboard to family planning partners across the country, including the family planning service providers themselves, who are the nurses and midwives and the doctors across the country. The RHD also commits to hosting family planning stakeholders meetings where there will be review of the data and discuss on how family planning partners can effectively be responding to the needs of women and girls based on the data and any gaps in it. With the $50,000 US, we'll convene meetings to develop the dashboard, recruit an IT consultant to support the Directorate of Planning and Policy Development, and then pay staff that will drive this agenda for the 4 months of the project. White Ribbon Alliance for Safe Motherhood and our partners are ready to solve this problem once and for all, and we hereby request your kind support to approve the resources for us to do so. We believe that this simple solution, once proven successful in Malawi, can be replicated in any country context using the DHIS tool and any other country that is facing a similar challenge like ours. We wish you all the best in your deliberations and are happy to answer any questions that you may have. Thank you so much for your attention.
Excellent job. Time for the Q&A. Judges?
Thank you, Lisa. Hester, I really like your pitch, very focused. But how are you going to get assurance that doctors and midwives will look at the dashboard? Because of their workload, usually they are not very much into looking for this kind of information. How are you going to assure them the importance of this dashboard?
So our work as White Ribbon Alliance, we're already working with associations of nurses and midwives, among that we are building their capacity. And through that, we have also raised the issue of data where the service providers themselves, they just perform without looking at what is happening. So through those meetings, it has come out clear that we need also to enforce and strengthen data use among the nurses, midwives, and the doctors themselves. And with these associations, that's where we'll bring in this information. And the leadership of the associations have already committed that they will be making sure that the information goes to all the service providers. So we are really good already that through their or existing platforms, this data will be shared. Yeah. And luckily it's just a dashboard, and that's what we want, that they can, within a very short time, be able to get the picture of what is happening. Thank you.
So my question is about sustainability. If you bring in an IT consultant to set up the dashboard initially, is there capacity in the reproductive health department to maintain that dashboard or adapt that dashboard over time?
Surely, yes, because the people that are managing the DHIS2 are IT, they're experts in that airfield. But for them to have time to develop the dashboard, and also making sure that they have this link, that's where they say they just need that external support for somebody to help. But picking it up from there, they're ready to do that. And the Reproductive Health Directorate as well, which has committed to sharing the information, has an IT person who has just joined and an intern who is also an IT expert. So already in terms of sustainability, within these two directorates, they have staff that will take it up, and they have made commitment, which once we get this money, we want them to actually sign to the commitment that they've made. Yeah.
The competition is heating up. Who will be one of our KM champion innovators? Only one pitch remains.
Hi, my name is Sibu. I lead the Zambian Youth Platform, currently the largest national youth network in the country. And we are ready to address the knowledge management challenges faced by family planning and reproductive health young professionals in Zambia. As a young professional myself, who has been working in this space for some time now, I'm very excited to have this opportunity to share the ZYP's KM innovation with you. As noted in the FP 2030 commitments, I quote, as governments and the global community prepare to respond to adolescent needs, we will need accurate data to inform policies and programs, measure progress, and ensure accountability at the country and global levels. And of course, as a result, the KM innovation that we propose helps address this need by adding to an existing community-led monitoring intervention led by young people. During the period we have been implementing community-led monitoring, we have realized that young professionals in the sector are doing a lot of amazingly innovative work that remains undocumented and unsupported. Some of the innovations could surely help address multiple family planning and reproductive health challenges if implemented at scale. We are seeking $50,000 to fund the Insight and Innovations Hub, an online platform designed to meet data and information needs for young professionals, as well as connect innovations to potential supporting partners. Currently, relevant data and policy information are scattered in different documents and websites. This makes it difficult for most young professionals to access data that could help inform their programming as they work towards addressing family planning and reproductive health challenges facing their fellow young people. Most innovations led by young professionals are stuck in pilot phase as they lack the ability to source funding to implement the innovations at scale. As a result, the Insight and Innovation Hub will provide easy access to information such as accurate analyzed data and information including related policies, strategic frameworks, standards and guidelines, innovations, frequently asked questions, and FP 2030 commitments. The solution will pull all the relevant data and information in one place in order to facilitate easy access for programming. This will improve evidence-informed programming and prevent professionals visiting numerous sites looking for information to aid their programming and support their innovation. In addition, the Insight and Innovation Hub will identify and document family planning and reproductive health innovations led by young professionals around the country, with the aim of shining a light on the innovators that are ready to scale and linking innovations to possible donors via its online innovation marketplace. The majority of the requested $50,000 will go towards the process of popularizing the online platform, identifying innovations, uploading them to the platform, coaching young family planning and reproductive health professionals on how to package their innovations, as well as use and maintain the platform, and hosting of a national awards ceremony. We will ensure meaningful involvement of the private sector in the implementation of all planned activities, thereby making it sustainable as private companies will continue to support the events beyond this initial seed funding. The supporting companies will have an opportunity to advertise their products and services during the planned in-person events, as well as on multiple ZYP online platforms, including the Insight and Innovations Hub, ZYP website, and all social media platforms. ZYP currently has over 5,000 individual members and close to 200 organizations, plus thousands of followers on other social media channels. The proposed Insight and Innovation Hub shall advance sustainable local solutions to family planning and reproductive health problems with potential for national impact and be a model to other countries as to how to meaningfully engage and amplify the voices and work of young professionals. With the requested funds, we can make not only the Insights and Innovation Hub a sustainable reality, but also ensure that our fellow youth's innovations are recognized and awarded as well. Thank you for your time and consideration.
Thank you for a great pitch. Time for our final Q&A. Over to you, judges.
Thank you. My question, thank you for the presentation, Sibu. My question just relates to wanting to hear and you unpack a little bit more of the details of what you were doing. Like, I get a very good sense of the vision, but less so how you execute on this vision. So can you talk a little bit about the specific activities you'll undertake and how you'll break out that $50,000 budget to achieve your vision?
The starting point, of course, is to set up this online platform. Then, as I said earlier, we will use our other existing platforms to put together, for instance, data, but also we want to put together a toolkit This is a policy toolkit. So the policy toolkit itself, it's a process that we already started working on, but now we'll try and synthesize it, because we know that there are some policy statements that sit in different documents. In certain documents, it's just a statement that will speak to family planning. So we want to put all those in one document, and that document will sit on our platform, meaning anything that relates to family planning policy information in the country will be found by at a click of a button. You'll be able to find this information and to refer them to which document this is sitting, so they're able to quote when they're trying to put together their documents. Then the other thing that we also do in terms of the innovation stage itself, we talked about popularizing the platform. So in the process of popularizing the platform, we'll popularize through our in-person activities. We have a countrywide presence, popularize the platform, and we'll start picking out some of those innovations through some provincial workshops that we plan to hold. So we already have a number of innovations that have been identified through our work, our community-led monitoring work, and we think that we have some sort of a head start in trying to identify some of those. But we also want to promote some level of independence through our other independent structures, such as our advisory panel, which will be able to assist in terms of putting together whatever it is we need to put together. Of course, we want to strengthen our partnerships with Ministry of Health in also working on this particular project. We want to work closely with the Ministry of Health, who are the drivers or the responsible party in terms of any health services around the country.
Thank you to all of the semi-finalists for sharing their exciting knowledge management innovations. It's clear that any one of these ideas would help to improve family planning and adolescent and youth sexual and reproductive health programming. The judges now have a hard decision to make. Which two should be funded?
I'm really pleased to announce the two winners of the pitch. Our first winner goes to the SWAG initiative for the initiative that they posed, which was Data for the Simple. This initiative to the judges was both innovative and was meeting an express need within that context for data on ANJ-SR. The judges were also really like the fact that this initiative proposed to work with and through existing structures at the state level, so that we know that this will not only be meeting a need, but it will be sustainable in the long term. So we're really pleased to announce SWAG with Data for the Simple as one of the winners.
This would be a great opportunity for Nigeria again to showcase that it can get it right with data, especially that those data are going to be simplified. But importantly is that those data speak to adolescent and youth sexual and reproductive health. And it means that I can team up with fellow young people to become key drivers in improving modern contraceptive rates amongst them in Nigeria.
Our second winner that we are pleased to announce goes to the White Ribbon Alliance for Safe Motherhood Malawi. This pitch looked at being able to make data available as well in more easily understood formats. In this pitch, we really love that it was taking some existing pieces within the system, the DHIS2 data, and making sure that that data is available and accessible through a dashboard. We know that this will be meeting a demand that has been expressed both at the policy level, but also within professional organizations and also among health service providers. Given that the initiative will be implemented through existing structures, we're also quite pleased that we feel that this will be sustainable and also feasible. So congratulations to the two winners, and we look forward to hearing the outcomes of these two innovative knowledge management initiatives.
This will be a very great achievement for Malawi as a country, because now what it means is that family planning stakeholders across the country, starting from the donors, you have the CSOs, but also the service providers themselves will be having access to family planning data. And it means that the decisions that will be made, the interventions that will be made, will be responding to the needs of women and girls in Malawi.
Once again, we'd like to express our deepest gratitude to all the semi-finalists for the effort that they have put forward in developing their pitches. All of the innovation shared today can be found on the Knowledge Success website at knowledgesuccess.org. We'd also like to thank our judges for their thoughtful deliberation and time today. We know that we did not ask them to make an easy decision. Finally, our sincerest thanks to you, semi-finalists, judges, and our listeners for your continued dedication to family planning and reproductive health. You are making a difference.